Peptic ulcer disease, PUD, is a common gastrointestinal disorder that affects millions of people worldwide. It is characterized by the formation of open sores or ulcers in the lining of the stomach, duodenum, or esophagus. The most common cause of PUD is infection with the bacterium Helicobacter pylori, H. pylori, which is responsible for up to 80% of cases. Other risk factors include the use of nonsteroidal anti-inflammatory drugs, NSAIDs, smoking, and excessive alcohol consumption. The symptoms of PUD can vary depending on the location and severity of the ulcer. Common symptoms include abdominal pain, bloating, nausea, vomiting, and weight loss. In some cases, PUD can lead to serious complications such as bleeding, perforation, and obstruction of the digestive tract. Diagnosis of PUD typically involves a combination of medical history, physical examination, and diagnostic tests such as endoscopy, biopsy, and blood tests. Treatment options for PUD include antibiotics to eradicate H. pylori infection, acid-suppressing medications to reduce stomach acid production, and lifestyle modifications such as avoiding NSAIDs and reducing alcohol consumption. In conclusion, PUD is a common gastrointestinal disorder that can cause significant discomfort and lead to serious complications if left untreated. It is important to seek medical attention if you experience symptoms of PUD, as early diagnosis and treatment can help prevent complications and improve outcomes. Peptic ulcer disease, PUD, is a condition that affects the lining of the stomach or the first part of the small intestine. It is a common gastrointestinal disorder that affects millions of people worldwide. The exact cause of PUD is not fully understood, but several factors have been identified as potential contributors to the development of this condition. One of the primary causes of PUD is the presence of a bacterium called Helicobacter pylori, H. pylori, in the stomach. This bacterium is known to cause inflammation and damage to the lining of the stomach, which can lead to the formation of ulcers. H. pylori is a common bacterium that can be transmitted through contaminated food or water, or through close contact with an infected person. Another significant factor that can contribute to the development of PUD is the prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs. These drugs are commonly used to treat pain and inflammation, but they can also cause irritation and damage to the lining of the stomach, which can lead to the formation of ulcers. NSAIDs work by blocking the production of prostaglandins, which are chemicals that help protect the stomach lining from damage. Other factors that can contribute to the development of PUD include smoking, excessive alcohol consumption, stress, and certain medical conditions such as Zollinger-Ellison syndrome. People who have a family history of PUD are also at an increased risk of developing this condition. In conclusion, PUD is a complex condition that can be caused by a variety of factors. The presence of H. pylori in the stomach, prolonged use of NSAIDs, smoking, excessive alcohol consumption, stress, and certain medical conditions are all potential contributors to the development of this condition. It is important to identify and address these factors to prevent the development of PUD and to manage the symptoms of this condition effectively. 1. Oatmeal. Oatmeal is a great food for peptic ulcer disease as it is high in fiber and low in fat. The fiber helps to reduce inflammation in the stomach and intestines, while the low fat content makes it easy to digest. Additionally, oatmeal contains avenanthramides, which have been shown to have anti-inflammatory properties. 2. Ginger. Ginger is a natural anti-inflammatory and can help to reduce inflammation in the stomach and intestines. It also has antibacterial properties that can help to fight off H. pylori, the bacteria that can cause peptic ulcers. 3. Leafy greens. Leafy greens such as spinach, kale, and collard greens are high in antioxidants and can help to reduce inflammation in the body. They are also rich in vitamin K, which can help to promote healthy blood clotting. 4. Lean protein. Lean protein sources such as chicken, fish, and tofu are easy to digest and can help to repair and rebuild the tissues in the stomach and intestines. They also provide essential amino acids that are necessary for the body to function properly. 5. Fermented foods. Fermented foods such as kefir, sauerkraut, and kimchi contain probiotics that can help to improve gut health and reduce inflammation. They also contain enzymes that can help to break down food and improve digestion. 1. Spicy foods. Spicy foods can irritate the lining of the stomach and worsen symptoms of peptic ulcer disease. It is best to avoid foods that contain chili peppers, hot sauce, and other spicy ingredients. 2. Citrus fruits. Citrus fruits such as oranges, lemons, and grapefruits are highly acidic and can irritate the lining of the stomach. It is best to limit or avoid these fruits if you have peptic ulcer disease. 3. Fried foods. Fried foods are high in fat and can take longer to digest, which can increase the risk of acid reflux and worsen symptoms of peptic ulcer disease. It is best to avoid fried foods such as fried chicken, French fries, and fried fish. 4. Chocolate. Chocolate contains caffeine and other stimulants that can increase acid production in the stomach and worsen symptoms of peptic ulcer disease. It is best to limit or avoid chocolate if you have this condition. 5. Alcohol. Alcohol can irritate the lining of the stomach and increase the production of stomach acid, which can worsen symptoms of peptic ulcer disease. It is best to limit or avoid alcohol if you have this condition. Peptic ulcer disease is a common condition that affects the digestive system. It occurs when the lining of the stomach or small intestine becomes damaged, leading to the formation of sores or ulcers. Peptic ulcers can cause a range of symptoms, including abdominal pain, bloating, nausea, and vomiting. In severe cases, they can lead to complications such as bleeding, perforation, or obstruction of the digestive tract. Fortunately, there are several steps you can take to prevent peptic ulcer disease. Here are some specific measures you can take. 1. Avoid triggers. Certain foods and beverages can irritate the lining of the stomach and increase the risk of developing peptic ulcers. These include spicy or fatty foods, alcohol, coffee, and acidic foods such as citrus fruits and tomatoes. Avoiding these triggers can help reduce your risk of developing peptic ulcers. 2. Quit smoking. Smoking can increase the production of stomach acid and weaken the protective lining of the stomach, making it more susceptible to damage. Quitting smoking can help reduce your risk of developing peptic ulcers and other digestive problems. 3. Manage stress. Stress can increase the production of stomach acid and make the symptoms of peptic ulcers worse. Finding ways to manage stress, such as through exercise, meditation, or therapy, can help reduce your risk of developing peptic ulcers. 4. Take medications as directed. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and aspirin, can increase the risk of developing peptic ulcers. If you need to take these medications, be sure to follow your doctor's instructions and take them with food to help protect your stomach lining. 5. Practice good hygiene. Peptic ulcers can be caused by a bacterial infection called Helicobacter pylori, H. pylori. Practicing good hygiene, such as washing your hands regularly and avoiding sharing utensils or drinking glasses with others, can help reduce your risk of infection. By following these measures, you can help reduce your risk of developing peptic ulcer disease and maintain good digestive health. If you experience symptoms such as abdominal pain, bloating, or nausea, be sure to see your doctor for an evaluation and treatment. Peptic ulcer disease is a common condition that affects the digestive system. It occurs when there is a break in the lining of the stomach or the duodenum, which is the first part of the small intestine. Symptoms of peptic ulcer disease include abdominal pain, bloating, nausea, vomiting, and loss of appetite. If left untreated, peptic ulcer disease can lead to serious complications such as bleeding and perforation of the stomach or duodenum. Fortunately, there are several ways to cure peptic ulcer disease. One of the most effective ways to cure peptic ulcer disease is to take medication. The most common medications used to treat peptic ulcer disease are proton pump inhibitors, PPIs, and histamine receptor blockers, H2 blockers. PPIs work by reducing the amount of acid produced by the stomach, while H2 blockers work by blocking the action of histamine, a chemical that stimulates the production of acid in the stomach. Both types of medications can help to heal the ulcer and relieve symptoms. Another way to cure peptic ulcer disease is to make lifestyle changes. This includes avoiding foods and drinks that can irritate the stomach lining, such as spicy foods, caffeine, and alcohol. Eating smaller, more frequent meals can also help to reduce symptoms. Quitting smoking is also important, as smoking can increase the production of stomach acid and delay the healing of the ulcer. In some cases, surgery may be necessary to cure peptic ulcer disease. This is usually only recommended if the ulcer is causing serious complications, such as bleeding or perforation. During surgery, the ulcer is removed and the surrounding tissue is repaired. In addition to these treatments, there are also several natural remedies that can help to cure peptic ulcer disease. These include eating a diet high in fiber, such as fruits, vegetables, and whole grains, which can help to reduce inflammation in the digestive system. Drinking chamomile tea can also help to soothe the stomach and reduce symptoms. Overall, there are several ways to cure peptic ulcer disease, including medication, lifestyle changes, surgery, and natural remedies. It is important to talk to a healthcare provider to determine the best course of treatment based on individual needs and circumstances. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.